All right, so this is Dr. R going back over some epi questions. This time we're going to be looking at different kinds of studies and some of the characteristics about them. So one of the first things I want to bring up is I put this little small thing together. It's not complete, but let's just kind of talk a little bit about this. We have descriptive studies. We also have comparative studies, and we have some experimental studies. So these are not completely discrete topics, but there's certain characteristics about them, and we'll go into them really quickly. So a descriptive study really aims to describe a population or a phenomenon or some kind of a disease that's happening in there. And when we do this at a single point in time, this is when we design a cross-sectional study. We can also look at creating case reports. That is oftentimes a unique disease state that comes up, or the first time something surfaces. So for like Ebola or the first time HIV, we might have an actual case report on that first patient 1 or patient 0, depending on where we're at. And then if we talk about them, multiple different patients with the same disease, so the first 3 patients that had Ebola, or the three patients that had HIV, then we're now talking about a case series. There's also an ecological, which is a population level, a descriptive study. So now let's talk a little bit about comparative. And so some examples are cohort and case control. So the cohort really follows people over time, observing relationships between exposures and outcomes. And this over time thing is quite important. And a case control compares cases to controls, i.e. case control, and it is retrospective. Another interesting thing to note, though, is that cross-sectional studies can also be comparative. We can collect data and compare what's actually happening at a single point in time. And so we might come back and visit that a little bit later. And then there's experimental, which we can talk about randomized controlled trials or crossovers. But let's get now to our question at hand. So a researcher is interested in studying the association. So there's an association between smoking and lung cancer. Often this is a big one we talk about. She designs a study to investigate this association and recruits participants who are either smokers or non-smokers. So what that tells me is that she has 2 different groups, and there are smokers and then there are non-smokers. She collects data on their smoking habits and their lung cancer status. So she's collecting data on smoking habits and cancer status. She then analyzes the data to see if there's a difference in lung cancer rates between the smokers and the non-smokers. And so the outcome would be cancer rates. So to me, this definitely looks like there's 2 groups and they're doing some kind of analysis. Rates. And they're trying to come up with some kind of an outcome. So let's think about this. Given the definition that I described before about a cohort study, are we following these people over time? Well, we're not actually following them over time. We're just collecting data in 2 groups, right? Smokers and non-smokers, and then we're asking them questions, and then we're determining their cancer rates. I don't see anything here about following them over time, right? So she collects data on their smoking, recruits participants who are either smokers or non-smokers, but I don't see anything about, asking them after 6 months what their lung cancer rates were. I see that she's collecting data on smoking habits and lung cancer status, which to me seems like it's at a point in time. So I don't think a cohort study is the most correct, right? We're always trying to get the most correct. A comparative study, are we comparing things? I think we are, so let's keep that one on there. Is this a descriptive study? Are we just describing what's happening, or are we actually collecting data and comparing these two groups to one another? We are comparing smokers versus non-smokers. So it's not a descriptive study. Is this an experimental study? Well, we are recruiting participants, but are we putting them in randomized groups? These groups are not randomized. Are we manipulating the variables? Are we saying that this group is exposed to something and this group is not exposed to something? No, actually we're not. They have self-selected as either a smoker or non-smoker, right? So we recruit participants and they either are smokers or non-smokers. It's not like we said, oh, I'm sorry, if you're a non-smoker, we need you to be a smoker. Ethically, it's not okay to do that, but that would be more of an experimental study. So an experimental study doesn't make sense. I really think that this could be a cohort study, and some people might get tripped up on that, but it has to follow people over time, and I don't see that here in the description. So to me, this is a comparative study, and the type of comparative study, and I talked about this before, would actually be a cross-sectional study, because it's collecting data at one point in time, even if it's about two groups, and then it is comparing those two groups towards their cancer rates. So for instance, if I drew a timeline here, and I was going to do this study, if it was a cohort study, then I would recruit people here, and then I would follow them over time, and then here I would actually collect their cancer rates. So how many of them got cancer? And I might even do that several times, because if this is years and not days or months, then there might be more times to collect data and look at their lung cancer status. So the comparative study would be that it's a cross-sectional study. We did it once, and it happened at one point in time. To me, that is the most correct answer.